Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now sclera. Sclera, we have one important thing which is episcleritis. Okay. Episcleritis occurs due to an idiopathic inflammation. It is acute onset with mild pain, redness and irritation. This episcleritis is an acute onset disease with mild pain, redness and irritation. On examination, you will see presence of the mobile vessels are seen and reddish hue is seen in those vessels, and those vessels will blanch on phenylephrine drops. Then treatment of this episcleritis can be, it is actually a self-limiting disorder, but we can consider usage of topical steroids especially in refractory cases. So episcleritis will actually look like this. It is an inflammation seen of the episcleritis, an idiopathic inflammation of episclera. Because it is an inflammation of episclera, that is one reason why these vessels are mobile and these are reddish hue is seen, and they blanch with phenylephrine drops because they are episcleral vessels.
thank you and thank you for watching.